someone on the Flexion Distraction table. Here we have Marge. She's positioned as such. I want the hips aligned, the top of the hip aligned with the crack between these pads, the chest pad and the lower lumbar pad. So as you scoot back just a little bit, get right about there. Good. Then over here, there's a hand release that it'll take some time to show. You won't be able to video it. And you grab underneath and you pull out, and you'll get this strap. This strap goes over the legs. It's the strap that holds down the legs and allows there to be a pulling pressure to be placed on someone. And so you want to pull it such that it pulls taut on the feet. And there's a top lever over here that when you push down on it, it drops up and elevates or drops the tail. Now it's all the way down. So good. So that's the first part of it. And then we're going to elevate the person. Sometimes the doctor's directions can be a high or low elevation. Here for Marge we're about moderate. We're about there. And then we can hit start from a couple different spots. Over here, there's an on-off button with this foot pedal, but I don't recommend using that because you don't know what the settings of the speed and the movement are like just yet. So we come over here to make sure that we have it set. On this side, it's always on the left side of the table. Over here you have some of the controls, and there's a little dot right on here. It says normal, which is really fast, and then slower. Normally what we do is turn it all the way down, hit the on-off button. It's not moving or doing anything at this time until we slowly bring it up, and now we start seeing it move down. And we want to do it to the comfort level of the patient. Marge is a little on the slower side. We want to bring this up a little bit higher. So I hit the button. Buttons are on both sides. That about good, Marge?
Yeah, we tried that.
Okay. And then we're going to leave here for about 5 minutes, let them sit and go through about 5-minute cycle, and then check back in on them, make sure everything's okay, elevate, change the speed, whatever we might need, or even decrease the speed, and then set it for another 5 minutes. 10 minutes total is generally what we want to do. After that, we stop, we'd hit the off button, we'd bring them down, undo the straps, and then ask them to slowly get up off the table under their own power. Alright, that's about it.